Welcome to the Casual Conversation, Wellness, Healing, and Healthcare with Daenerys, a podcast about healthcare through the lenses of mental health, microaggressions, and systemic bias. So come in, grab a cup of tea, and let's have a conversation. Welcome back to the Casual Conversation, Wellness, Healing, and Healthcare with your host, me, Daenerys. And hey, I'm geek, man. I got a special guest in the building. This is my friend, my dear friend, my close friend. We've been friends, been locked in for 9 years. Cam.
Hey, y'all.
What's happening?
What's happening? I am excited.
How you feeling?
I'm great. I feel amazing.
Me too.
I am excited. I am grateful. And I'm just blessed to be here with you in your space. So
I'm blessed to have you, man.
yeah.
You made me cry already, bruh.
Look, don't do it. Don't do it.
You made me cry already, man. This is for sure. So if y'all ain't know, let me introduce Cam to y'all real quick. You know what I'm saying? I'm talking about Cam. Cam is, she ain't the one to play with, okay? Let me tell you about it real quick.
Yeah,
Cam is a certified herbalist, holistic nutritionist, wellness coach, Reiki practitioner, dedicated to educating and empowering her community on how to naturally manage stress, balance hormones, and support chronic conditions. As the founder of Loon Herbals, get you some Loon Herbals. She offers plant-based remedies centered around deep healing, not just symptom management. With a background in Western herbalism from the Southwest Institute of Healing Arts and a passion for education, Cam is here to shift the conversations from prescriptions to prevention. Woo!
Yeah.
So on today's episode, she shares the real difference between Western herbalism and Western medicine and how reconnecting with nature, nourishment, and energy work can lead to lasting wellness.
Yes.
So with that being said, y'all, this is episode number 6. So this one is about Western medicine versus Western herbalism. Which one's right? Which one's wrong, if any? And can we both just coexist? Can we work together? Can we collaborate? You know what I'm saying? So I think this is a very interesting take. I know in my practice, me being a nurse for 7 years, I have a lot of patients that, you know, are on certain medications and they ask me for natural remedies for, you know, different things because they don't like the blood pressure medicine or whatever the doctor has them on. It has them feeling weird, or, you know, it just has them just in a space where it's like, I don't really want to take medicine. I really want to just handle it naturally. So this is the guru of everything natural, everything herbs. She went to school for this, and just as a friend, I'm just super proud of her, and I'm just so blessed and grateful to have her on the platform.
Thank you.
For sure. This is very much in alignment.
I appreciate it. Yes.
And yeah, you know, before I start crying, let's get into
who would have
it.
thought we'd be here?
You know, for sure. But you know, this is a casual conversation, so we real casual.
Yeah.
You know, we're gonna have some real conversations, and we may even get into some arguments. I don't know.
Maybe
We'll see.
a little bit. We'll see what happens.
Just a little bit, you know what I'm saying?
Yeah.
All right, so cool. So with that, we're gonna start out with just like my background once again. Y'all know me if you've been watching the previous couple of episodes. My background is ER nursing, 7 years. I have travel nursed. I've been a teacher. I've done outpatient. I've done all type of stuff, right? I've been in a lot of environments, and I've been in a lot of different spaces where medicine is practiced. Remember in episode 1, which I'll link right here if you ain't watched it, I talk about how in the west of the United States, the medicine is different than in the South where I currently live. You know what I'm saying? Like, just how they just treat different illnesses is just different in itself. So that's already like a difference to just learn and, you know, just like know. But just now to add the herbalistic side, like the holistic side of things, I think it's real interesting. Like, cause for me, I ain't gonna hold y'all. Like, I got introduced to holistic medicine through my therapist. And if you watch episode 2, which is about death and dying and grief, I talk about how during COVID, I experienced a lot of panic attacks, anxiety, and I was seeing a therapist. You know what I'm saying? And shout out to my therapist for sure. She is very holistic based. So she believes in meditation, journaling. She believes in sound baths, all those things, teas. You know what I'm saying? Like, she really put me on to stuff that I ain't really think was like real, but it really worked. Like, you know what I'm saying? Like, if you know me in real life, I'm the self-care queen, baby. Teas, journaling, meditation, outdoors.
Gotta have it.
Gotta have it. Look, that vitamin D, that sun, it'll change your life, baby. I'm telling you.
It will.
Change your life. So with that being said, like, with my therapist putting me on to the holistic side of things, and not just taking like a pill from a doctor, you know what I'm saying? Like, for anxiety. I actually did wing myself off of anxiety medicine, actually, and started to really like dive into the holistic side. Yeah. And since then, man, I've been feeling so good. Yeah. But I do know that with that, it takes time. Yeah. You know what I'm saying? Yeah. So with that being said, like, I want to ask you, Cam, how did you get into your career field? Yeah. What inspired you to want to try herbs and things like that? You know what I'm saying?
Yeah, I say for me, it was definitely a journey. Similar to you, I was dealing with some emotional grief, pain, traumas that was coming up, dealing with mostly my childhood, just things that I feel like I've accumulated throughout my relationship life, and just needed to heal myself as a whole at a root type of way. So seek therapy. I thought about different ways that I could start with this, and that's what kind of brought me into more spirituality practices, which includes the holistic practices that you spoke of, meditation, making sure you're getting your nature time, making sure that you are taking a little herbs, whatever that may be, if that's a tea or if that's any type of liquid extract or whatever.
By the way, y'all, her tea is bomb.
It's real good.
I ain't gonna hold you.
It's real good. So yeah. I was just like looking for healing, and I just felt that with medicines, I didn't want to be on like anxiety or depression medicine, but I knew I was hurt.
For sure.
And so I just started with kind of the same things that you started with. I didn't go to the therapist. I just started speaking to myself and doing meditations. And when I realized I can have quiet in my mind with the practice, it was something that was so opening for my growth. I became a lot more stable in my own energy. And then once I started learning about crystals, and then after crystals, it was like herbs. And I was like, oh, so there's actually plant medicines that are not a substitute, but can be an alternative to pharmaceuticals.
Absolutely.
And I was like, well, okay, I don't want to be on anything for anxiety or depression, but I don't mind drinking tea. So found out about lemon balm, which is included in our tea today, which is tranquility. And it's good for anxiety, nervousness, depression, and also for digestive system support. So it really helps with any gas and bloating. And I don't know, when I met the herb lemon balm and I started drinking her, it was like my life changed. And I don't want to say like so suddenly, but it took time for me to actually nurture and grow my relationship with actually taking herbs. And so once I realized this, I was like, hey, there's a lot of healing in this one plant. How many more are there? How much more can I learn? This was like right at the precipice of COVID. And so everyone was kind of locked up anyway. For sure. And I didn't want to do online classes, but I wanted to start to learn on my own. So I just started doing research, buying books, and figuring out about it that way. And eventually it led me to SWIHA, or the school I went to, Southwest Institute of Healing Arts. I moved to California during COVID, crazy as hell.
You did, bro. I remember that.
Crazy. Excuse me.
Nah, you cool.
But it was 2021. The government was giving a little free money. Man. You know what I'm saying? And if I'm going to bet on anything, I'm going to bet on myself.
For sure.
And I always felt like I was an LA West Coast girl because, like you say, it's not a lot of openness in Alabama to other practices. I started meditating. My mom was like, are you a Buddhist now? I'm like, I'm just quiet in my mind. And so I was like, well, let me go to the West Coast because that's where it's celebrated. I was doing tarot. I was doing my crystals, my herbs and stuff. And so I went out there and I found that LA wasn't the spot for me, but I learned about myself and I was able to move to where my school is located at and got enrolled and I've been there since. Even ended up working there for a year. And I just feel like it was so supplemental to my confidence, my growth, and just for being able to trust in other ways that I can heal myself. And it gave me my power back. Instead of me just trusting in something outside of myself, I realized that healing comes from within.
Absolutely.
And it starts with first believing that you can be healed. It's the belief. It starts with the mind first. So once you have the belief, and then you have the tools, and then you have the patience, all of that incorporated together.
That's all I was finna say. It starts with your mind.
Yeah.
Whatever your mind say it can do, you're going to do. You're going to do.
So that's a long way of bringing me to where I started and how I got into doing this as a career. It was just for me. If I could be honest, it was a little selfish, but I was looking to heal myself and figure out different ways other than what my mom, what my dad, my brother, all of them dealing with high blood pressure. I wanted to prevent that. I didn't want to have diabetes or any of the easily predisposed.
Yeah, it's predisposed.
To Black community. And so, yeah, I just wanted to be the change for my generation.
For sure.
So ultimately, I found herbs, or herbs found me rather, and that was the path that I took to help heal myself and then learn to heal others.
For sure. That's beautiful. Thank you for sharing.
Yes.
I do have a question. So, like, within that space, like, what do you offer? What do you do? Like, can you kind of tell the listeners a little bit more about you?
So about me specifically, I do, well, I'm a herbalist, so I have trained for Western herbalism. And I'm also...
real quick, how long is that program?
It's a year and a half.
Gotcha.
So I have a diploma. It's not a licensed field, and it's not necessarily a certifiable field, but if you have backing behind, like, you working with clients one-on-one, you can become a registered herbalist, which would give you more credentials.
Okay.
So I'm an herbalist. I'm not registered yet, but I've been building up my hours because I work one-on-one with clients. So I do herbal consultations one-on-one. I work at a naturopathic doctor's office part-time as a lifestyle coach. So that is where I offer holistic nutrition support and health and wellness coaching support.
Okay.
So herbalism, health and wellness, holistic nutrition, and the last thing I just added is Reiki practice.
What's that?
I love Reiki.
What's that? Tell us about what's Reiki.
So
I know about Reiki, but I feel like Reiki is like just now becoming like, I don't want to say popular, but it's becoming normalized.
Mainstream.
You feel me? Like mainstream.
I feel like a lot of people know about these practices, but they don't know about them until it's on TikTok or it's like a viral sensation. And that's okay. However you get your education, that's fine.
Yeah.
But Reiki is an energetic medicine, in my opinion. It helps with balancing your chakra system or any blockages or stagnancy that you may have within your energetic aura. We're all energy. We all have electric fields around us. And your aura is going to attract or repel certain things.
Can I add something?
Yeah.
Even inanimate objects have energy too.
Exactly.
Like our cell phones.
Yes. Even plants.
Even plants. Yo, Richard.
Where Richard?
Richard, well, he's over there. But Richard, I've noticed that plants are energy.
Yes.
And I know that they're alive, but I've watched him specifically, and he'll shift from leaning this way to another week he'll be this way.
Yeah.
And I'm like, how's he doing that? But I feel like he's guided by the light, by the sunlight.
Of course.
So wherever the sun is kind of shining.
Lean to it.
Correct. Because as the world's turning, the sun is shining a different angle. So yeah. So I feel like me growing a plant. Yes, I'm a plant mom. Thank you. Yeah. For 3 years now. Thank you. But yeah. So Richard is big now. So I've been paying more attention to him. So even just how he shifts, I'm like, yo, plants have energy. Even that was just mind blowing. I ain't mean to cut you off.
No, but you're fine.
That's
basically what I was getting to. Everything has energy. And when you're able to tap in to life force energy or life source energy, it's basically just channeling in high vibrational energy into myself as a vessel to help facilitate healing. So it's either a light touch, or I can just hover over the body, over the different chakras, and just intentionally send energy. So just like you talked about your plants, it worked for mine back home. I was starting a plant bed, and I actually planted some seeds. After I learned Reiki, I went home and I played Reiki music for them. Reiki music. So it's frequency music, high vibrational music.
Yeah.
So I just played some Reiki music, and they grew like wildly within the next few days. So I realized talking to them, playing Reiki music for them, loving them, anything that has an energy.
Touching your plants. Yes. Please touch them.
So it all dials back to energy. So you can tell energy to leave, which is what Reiki can do. Like you can release attachment with certain Reiki symbols and just be able to be in your own vibration to where you are clear, self-aware, grounded, relaxed, and you know your heart. You know what I'm saying? You know your vibration, and nothing outside of you is affecting you because you've been able to harness and ground into yourself. That's what Reiki's done for me. It helps me to stop carrying other people BS. Which is one of the biggest things as a people pleaser, but we're not gonna go into this episode.
Yeah, we not. We gotta leave that. It's like a little mental health type of episode.
But yeah, it just really helped me to separate what was mine and what wasn't.
Right.
And that was healing for me. And I like to give people that medicine.
That experience, yeah. That's what's up. Okay. Well, we'll get into how they can contact you afterwards, but let's stay on topic. So, so next, I want to kind of discuss a little bit about the differences between Western medicine versus holistic medicine.
Okay. So
I guess we can kind of get into like, okay, so for example, in my practice, right, I'm an ER nurse by trade. That's primarily my background. I have a little sprinkle of other specialties, but that's primarily what I can speak to, right? And so there have been instances where patients, again, like how I mentioned earlier, are on blood pressure medicine. They're on diabetes medicine. They're having migraines all the time, right? And there's medicine for that too. But, you know, I feel like patients can feel safe with me. So they're always just telling me like they're just most vulnerable things. And I've gotten over and over and over again, like, Serena, how can I get off this? Serena, what can I do alternatively to kind of help heal me or supplement my healing? You know what I'm saying? And so far, all I got is just diet and journaling and some meditation too. But, you know, now that Cam's been in my life, but now that she is in the career field that she is in, like, we've had discussions, but just to educate the listeners, you guys, like, how can somebody with blood pressure kind of wean themselves off of it or supplement their healing to, you know, naturally take care of that? You know what I'm saying?
Yeah. So kind of like what you said a little bit earlier, or kind of while you were talking, with Western medicine, it can be more symptomatic or symptom management. And with herbalism, we look at the whole person. That's why it's called holistic medicine. That's, you didn't even put that together, did you?
Yo! Holistic.
It's the whole person.
The whole person. Yo! I'm just now, like, in real time, like, figuring that out, like, for real. I didn't even put two and two together.
Yeah. So holistic medicine, the emotional, the physical, the spiritual, and then the mental. So you look at the whole person. So when it comes to herbalism, instead of just giving them something that'll help with the high blood pressure in itself, I give them something that can help with the stress. So ashwagandha is an herb that is very good as an adaptogen, which means it helps you deal with your daily stress, and it helps with your cortisol levels. So with ashwagandha, it is more helpful for if you get high blood pressure due to emotional spikes.
Right.
I partnered that usually with hawthorn, which is another herb that's really good for cardiovascular support. So these two together can help with supporting the heart, help with emotional stress, and then help with lowering your blood pressure. So with hawthorn berry is very good for the blood vessels and also helps with the heartbeat itself. So it's literally a heart medicine. So partnering those two together are really helpful for just dealing with daily stress and help weaning off the medicine. So when you are taking herbs, you don't want to take both at the same time. But if it's not, even just starting with the herbal medicines, which I know we're going to talk about in deeper a little bit. I got ahead of myself, but even just meditation, I know we talked about that over and over, but meditation doesn't have to be you sitting in a squat pose or, you know, sitting in all it doesn't have to be. Walking is a meditation. Writing is a meditation. Anything that you can do with attention to your breath and with an intention to meditate can be a meditation, even if you're just washing the dishes. That can help calm your heart, stop it from overbeating or, pumping too much blood throughout your body to where it leads to high blood pressure. So,
yeah, like for me, like my meditation that I'm finding is the shower.
Ooh.
The shower
it's
is
magical.
Man, what?
Water. We just talked about energy. You can tell water what to do for you.
You feel
know
me?
what I'm saying? Cleanse
And I'm a water
today's
sign.
off of me. Yeah.
I'm a
cleanse
water
today's
sign.
worries. Cleanse today's stresses. You
But
can tell it what to do for you.
I literally have found myself zoning out in the shower and coming back into my body like, whoa, like,
where did I just go?
Yeah. And like, I get so many different messages and downloads and just what God or higher power or whatever you believe in, right?
Yeah.
It talks to me in the shower. Like, I mean, it's powerful because in the shower, I don't listen to no music, nothing. I just go in there. I just kind of just, let the shower just come down.
Yeah.
I watch a little bit, you know what I'm saying? But like during that time though, I do like zone out. Yeah. And it's like, this is powerful. So I think that my method of meditation is showering for sure.
Because you're a water sign. I don't want to put into astrological.
Right.
But I'm an earth sign. I love outdoors. I have to go, not have
You
to. I
do
love
like
to go
it,
sit by trees,
Yeah,
get
you
in the
do.
grass, go on a hike.
You are an outdoorsy person.
I'm an outdoorsy person. So again, it all goes back to energy.
Yep, it does. So like staying on the topic of blood pressure, right?
Yeah.
So I've spoke about this in previous episodes. Can't remember exactly what episode I did speak about this with, but I do remember giving an example of blood pressure medication. If you're not getting the right one, can cause long-term effects, right? But just having high blood pressure in general, I've talked about, is a silent killer. You don't really get many symptoms with high blood pressure. You may get a headache, you may get certain things, but as a collective, you really don't know you have high blood pressure until you have it like checked, right? So which high blood pressure can lead to strokes, heart attacks, and things like that are very, very urgent, that are emergent. Western medicine, hello. So I guess like my whole thing is but I guess I'm trying to figure out how can we still give somebody urgent treatment, but still on the back end collaborate with holistic medicine. Like how can we collaborate on that with the blood pressure? Because I think that is a most common thing that I do get in my personal practice of like, how can I get off of it? Because a lot of patients don't like the side effects that it makes them feel like. For example, there is one blood pressure medicine called lisinopril, and that medicine, specifically for Black and brown people, African Americans, it can cause what's called angioedema, which can cause swelling of the tongue and the lips. And in extreme cases, it can block your airway and you can't breathe. Are you familiar with that?
I haven't heard of that before.
That's like a real common thing, and my nurses and doctors can definitely agree with me on that. So we try not to put Black people on that, but that can be a side effect. So that it makes them feel weird. Some people say that it makes them feel dizzy. So with all these different side effects that are treating the actual disease but not the cause, I guess what I'm asking is, how can we treat the cause of the blood pressure so it doesn't manifest into a emergency of where I have to come in and save somebody's life. You feel me?
That's where preventative medicine comes in, or preventative measures, rather, stopping it before it gets that far. But if they've gotten to the point where it is emergency, I would say treat the emergency and then work from there to get them to wean off the medicine. If they haven't had an emergency yet, like I can say for myself, I've never dealt with high blood pressure in my life, knock on wood. Probably never will. But for me, I also make sure I have self-care practices. You're the self-care queen. I won't say I'm the queen of it, but I do enjoy taking care of myself. So like I do my morning tea. Every morning I'll have tea. The tea that I have is going to have an herb specific for stress, more than likely. I also make sure I do slow mornings. I don't like waking up in a rush. It jumps you out your sleep, rushes your adrenaline, all that, which I feel like is not good for the cortisol levels of your body. So having slow starts to your day can be something to implement, but also making sure you're setting time aside for yourself. A lot of the clients I work with are over givers. they're stressing about helping everybody else but themselves. They have their mom, their kids.
Us nurses are bad about doing that, by the way.
You know what I'm saying? They may have their kids' boyfriend, because at their age, I work with mostly women and older women, and they're trying to regain back their lives after they've given so much of themselves, right? And so I would say, before you get to that point, just start putting yourself first. Learn no. That's a simple way to stop stress. You know, I mean, I don't want to get that simple to it, but it's about just taking care of yourself and do what's best for you at any aspect of your life, whether that's just health, whether that's relationship, whether that's work life. Stop taking work home with you. I deal with a lot of people that are either entrepreneurs or they run businesses, so it's difficult for them to not be in a high-strung energy. So I have to tell these women, you gotta, hey, do some type of breath work before you go to sleep, because you're laying down and you're restless by the time you lay in bed and you can't fall asleep. So you can take this tea, you can take this tincture, but there's also something that you need to do to help your mind. So I would just say, learning to take care of yourself, which can be difficult for us or anybody.
For sure. Y'all know what I always say. Self-care is mandatory, bro. It's not a reward. It's not a luxury. Like, it's mandatory. I have to schedule my self-care in. And it's not like it's every Monday or every Friday. Like, it's just, I have to schedule it in, just like I work out, just like I eat healthy, just like I have to wake up and go to work. Like, it's within my routine. Because if I don't have my self-care, my cup is not full for me to be able to pour into other people's cups. It's a very cliche saying, but
it's very true.
You cannot pour from an empty cup.
We 30 now.
We 30,
now
bro.
Now it's real.
It is.
At
My back be
like, oh, you can't pour from an empty cup, but like, no.
No, you really can't.
You really can't.
You really cannot. And you know me in real life, and anybody who does know me in real life, I'm very high energy. But if I do not have my time of solitude to recharge my battery, I'm not a cool person. Like, I have to have that balance and that duality of high energy, but also being in solitude to regather myself, think, figure out, okay, how am I feeling today? Like, what do I need to give to myself? What do I need to pay attention to my body? Like, being 30, man, your knees start hurting, your back start hurting, all types of stuff start hurting. But we're not gonna get into all that. So
I got some for your knees and your back too.
For real.
I got some salves. We can rub some on you.
Nah, for real. But the next topic that I think is also common in a lot of Western medicine that we're having to treat very often than not is diabetes. Them sugars.
Them sugars.
Them sugars, man. Them sugars.
Yeah, I like them sweets.
Them sweets, man. We know diet, of course, so we'll get into diet in a minute. But if a patient were to say, I don't want to take insulin, let me back up a little bit before I get to insulin. Before insulin, if you're pre-diabetic, you'll get on what's called metformin, which is a pill, right? That's for pre-diabetes. It helps to treat, manage symptoms, you know what I'm saying? If you're diabetic, then you'll get into the insulin realm where you're giving yourself shots, you're checking your blood sugar on a regular before you eat, after you eat, things like that. And et cetera, et cetera, et cetera. So, a lot of people talking about compliance are not compliant with their diabetes. No. I think that is one of the most common things that we see in the ER as far as common readmissions is diabetics that go into diabetic ketoacidosis, DKA, and that's gotta go to ICU for that, baby. You know what I'm saying? You gotta get your blood sugar checked on the hour, every hour. You getting insulin every hour on the hour. I mean, constantly. So because it's an imbalance of your acid versus your basic with your pH. Not to get too scientific, but that's just what it is. And if you have an influx of sugar into your cells, that can cause damage to your kidneys. It can cause damage to your heart. I mean, all type of things. So again, not to go too specific into the scientific part of it, I want to keep it digestible for the audience. How can we help people who are diabetic or pre-diabetic kind of, I guess, self-heal? with your herbs.
Yes. So I actually make blood sugar balance capsules. And in the capsules is one herb that's very important. It's called gymnema or gymnema. It is good or very, it really helps with, first of all, it helps with reducing your taste to sweetness. So if you take gymnema, you put it on your tongue. If you try to eat cake or something sweet after it, you can't even taste the sweetness of it.
I have a question with that though.
Yeah.
So I watch YouTube a lot.
Yeah.
I'm not gonna say who I heard this from.
Yeah.
But I heard that like if you have sugar cravings, that's parasites. Is that true?
It could be linked to that. It could be linked to that. It could be, yeah. I don't want to say yes, but then also it could be. Yeah.
Okay.
Because parasites do thrive on like
Sugar and like yeast and stuff
Yeah,
like that.
yeah.
Got you. Okay.
Yeah.
You know, I just didn't know. So.
No, it's all good. It's all good.
yeah,
Don't
for
mean
sure,
you got
for sure, for
parasites,
sure,
but
for
you do
sure.
need to do parasite cleanses because
sure.
if you eat meat, this is easily
Parasites are real.
Yeah.
Yeah. But okay.
But gymnema is good for helping reduce your sugar, how you taste it, but then it's also really good for helping your balance of your blood sugar. And then it also can help you build your insulin within your pancreas because it works with, well, not to get too deep into it, but it can help with building insulin. So if you take gymnema, it is known in Ayurvedic medicine to be very, very successful for type 2 diabetes, not type 1, because type 1 diabetes is something that's more of a genetic.
That's genetic. Mm-hmm.
But type 2 is something that
Lifestyle
could be,
and you being sedentary and all that. Yep.
So things like gymnema is a good herb, and then fenugreek, anything that is good for like helping reduce your sugar cravings, but also help with your blood sugar. So if you take it right after you eat, it helps supplement or make sure it's not like you say a big rush of sugar into your body. So it helps with just making sure they're nice and level.
You're stable in your blood sugar levels for sure.
And then this can also help with weight loss, apologies. So the blood sugar balance capsules can assist with weight loss as well, just because again it helps with reducing your cravings.
So basically, y'all, what she's saying is this is a natural, Ozempic. It's a natural semaglutide. It's a natural Wegovy. Come on, somebody.
Be trying to tell people,
Come on,
get
somebody.
these capsules. They gonna
Get
do
the
the
capsules,
same
man.
thing.
And I have to say this. I really do. People suffer a lot of complications with that.
I feel like in a couple years, we're going to hear a lot of flack about
Them
this
commercials. If you've ever taken
Please call this number.
Please
You
call
may be
this
entitled to a settlement. Because what? It works.
Yeah.
I'm not saying it doesn't work. I actually work with a naturopathic doctor who does the shot and prescribes it, but I work one-on-one with those clients to make sure they're getting sustainable weight loss. So I'm giving them meal plans. I'm helping them with their water intake, making sure if they want to supplement, they can help with their liver load, because constantly taking chemical medicines, it's going to be taxing for your liver. You're going to make sure you're detoxifying your body.
and your kidneys too.
Your kidneys. Yep. So I don't want to say you have to choose. I think that there can be a middle ground. But I don't want people to rely too much on the semaglutide for sure.
Yeah.
Especially if it's just specifically for weight loss. Let them people have their medicine for their diabetes.
Yeah, y'all are taking away from the people that really need that medicine. But also too, just speaking to seeing people that come in for complications from.
Oh, really?
Yeah, it's bad. Like they be like cold sweat. They be throwing up profusely. It's bad. Like the Ozempic, because again, not to get too scientific, the purpose of it is to stabilize like your blood sugar, right? So a side effect of it is weight loss. So I know in Western medicine, and this is again how like the difference is, we sometimes prescribe certain medicines that are not intended for. So for example, right? What?
Like
What's
they
up?
do
What's up?
blood, like they do birth control for acne.
Yes.
I hate that.
Yes.
You're giving me fake hormones
to
to
control
help my acne.
Right. Another example is it's a mental health medicine called Haldol. That's for like schizophrenia, aggression. It's another big one I'm missing right now. I ain't gonna hold you. But I know in the ER sometimes we give that in extreme cases for uncontrolled nausea and vomiting. It's really good for that. So you're basically getting a mental health medication to control your nausea and vomiting if it's that bad. So that's another example of something that we give that's not for the intended use, but because the side effect is just as good. Another one more. It's another medication called hydroxyzine. That's an antihistamine. So it's the cousin or sister of Benadryl in allergy. So we give that for anxiety sometimes. Like, that's a low-level medication for anxiety. So they'll most likely give you that before they'll do Xanax and stuff like that. Yeah.
So it's crazy how...
And they did give me hydroxyzine back, during COVID when I had my anxiety medicine.
So it's medicine is made for certain things that can be used for other, and it just so happens to be a side effect of this medicine. Interesting.
Yeah. It's crazy, right?
Yeah, it's very interesting to think about.
Yeah, for sure. So, real quick to kind of wrap up the diabetes portion of this. Have you ever seen or have you ever worked with a client that had diabetes, got on your protocol, and it got reversed?
Not yet. I've been looking for somebody that will actually be compliant, as we were talking about.
The compliance.
I've had somebody to take the capsules and stated that they have worked and helped her with her cravings and helped her feel like she was not eating as much, because it also helps you feel full. I forgot about that. That's one of the biggest pieces of Ozempic. It helps you deal with your satiety, or helps you with not wanting to overeat or eat as much. So when people take this medicine, they don't even want to eat most of the time.
Yep.
So back to what I was talking about. The blood sugar capsules can help you feel more full if you take it with the meal, and it helps you reduce your sugar cravings, which can in turn, weight loss could be, like you say, a side effect of it.
Right.
Yeah. But I haven't had anybody that's just like willing to work with me as a herbal protocol person. No. The people I do work with, they are on semaglutide or GLP. And it's not for diabetes, though. It's specifically for the weight loss, which I'm just like, I'm with you to help, but we're going to make it more sustainable for you.
For sure. Okay. So I think the last big topic that we're going to talk about, that a lot of people experience, especially in Western culture, migraines. And I think that migraines is a good topic to talk about because it's not a one-size-fits-all. Migraines are something that it's, by definition, if you fit, this many out of this many symptoms, then they kind of categorize you as a migraine or a headache. There are medications specifically for migraines. So you got Fioricet, you have Topramite or Topramax for migraines as well. Those are just a couple of examples. We also give a migraine cocktail in the ER, which is simply like magnesium, which, real quick, magnesium is a smooth muscle dilator, so it helps to dilate your blood vessels, which sometimes can be caused by migraines from constriction of your blood vessels.
Put something together for me in my head.
Oh, yeah.
Because I tell people that deal with migraines, they have magnesium-rich foods. So the fact that you're saying to take magnesium as a supplement, it just...
Word. Yeah, we give that in the ER. Yeah. So we'll do like sometime, which again, this is how the South versus Western, like Cali and all that, how they do medicine. We'll do the magnesium. We'll do antihistamine. We'll do a anti-nausea medicine, and then we'll also do like a form of a steroid, mixed with like a pain medicine in there a little bit, just to kind of make you comfortable. But yeah, that's pretty much the migraine cocktail. It's just I think that's one of those, like, we're just treating the symptoms and not the real problem. But, hey.
Yeah, migraines can be for, like you say, a whole host of different things.
It is. Yeah. And I feel like most commonly migraines come from stress.
Yeah. And I would definitely say inflammation too. So make sure you're addressing any inflammation that can really be helpful for migraines. So I would like to say like things like feverfew. That's an herb that's good for headaches and migraines. Helps with reducing fever, but also with any type of tension or stress headaches. And then I like white willow, which is actually what aspirin was derived from. That's also just good for any pain, especially like lower back pain. And it helps lower inflammation within the body. So I always just not prescribe, but suggest those two herbs, and I have capsules with those in them too for migraines.
For sure. A thought came up for me just now, and again, I just love that we're having this conversation because it's like real time learning for me.
Yeah.
Was, I've been night shift my whole career, so 7 years in, right? And my routine's a little bit different now. I'm very much so used to it, but I do remember like around the COVID era, so I was like 4 years into my career, I was getting real bad migraines. You know what I'm saying? And I think it was a mix of stress and fear and stuff like that from the pandemic, but also too, I wasn't sleeping. I was not sleeping at all. And so I started to take supplements, the magnesium supplements, and I learned off TikTok, by the way, but
magnesium is just really good for you, especially
is.
for like menstrual cramps. If I could just add that in, if you deal with menstrual pains, magnesium is
I
going
don't
to be
got
really
no
great.
issues, thank God, but
Me either, girl.
but yeah, I was taking like the migraine tablets, like the supplements, like over the counter, and I was getting deep sleep. I thought that was so crazy.
It's good for you. Magnesium. I had a spray. It helps with calming the body. It helps with stress. It helps with cramping, like you say, it smooths the
It's a
muscles.
smooth muscle dilator.
Basically, yes.
Because we also give magnesium for real bad asthma attacks as well. Like
if you take it at night before sleep, you'll get a good night's rest of sleep.
So we do it for asthma, and then also too we do it for patients that are like pregnant and have like preeclampsia and stuff like that too. So it'll help relax those blood vessels. Because preeclampsia is like where you have high blood pressure and stuff like that
While you're pregnant.
like while you're pregnant.
Yeah, magnesium is that, girl.
Yeah,
I used to do a spray with her like every morning on my stomach. It's just good for, like what we talked about, most of relaxation, then rest, helps with stress a little bit, and then just help with I think overall support. I like magnesium.
For sure. So I guess for people, so since the migraines and the headaches are not a one size fit all, or it's not in a box, it can come from different things. I guess what advice would you give the listeners if they are getting recurrent migraines or just nagging headaches? What are a few things that you would suggest to them to do to kind of see if it fixes it before trying to go to a doctor, a Western doctor?
Yeah, I would say implementing things like we talked about, like magnesium, that could be helpful. Essential oils can be helpful as well for migraines and headaches. If you like peppermint, you can put that on your temple or you can sniff it. Aromatherapy is really helpful. I hope y'all don't think that's too woo-woo, but aromatherapy is powerful. So even just sniffing essential oils, even not even taking the herb, can help.
Yeah.
But tea, peppermint is good for headaches. If you are open to capsules, things with like feverfew that I mentioned earlier, or white willow bark is really good because it helps with lowering the inflammation, which could be one of the causes of the migraine. So just some of the things I would say, but also relax. Take some deep breaths. I like breath work. It's very important.
For sure.
Yeah.
Okay. So, diet. Let's get into diet real quick.
Let's talk about it.
I think that diet is one of the fundamental things that causes a lot of illness, a lot of disease. And I'm happy that we're having this conversation because I don't want to share, but I do want to share some examples of how like people just don't care about their diet.
They don't.
And how that really affects them in real time.
It's not that people don't care. We've just been taught a way of eating that's not for living. We're living to eat, not eating to live.
Correct.
So the pyramid they taught us,
it's not. No, it's not.
You don't need all that shit on
You
your
don't. Nope.
You don't need all that on your plate.
Nope, you don't. You don't. That is incorrect. That food pyramid is incorrect.
Yeah, so it's just,
incorrect.
as a basis, standard American diet has taught us horrible ways of feeding our bodies. So it's all about education and being open to make the changes when you see that your health is being compromised.
Right.
If you see that you're dealing with high blood pressure, it's sodium, or it could be sodium influence. You just have to take a time to look at your blood levels, get your blood work done, and you can look and see exactly what is causing some of the ailments, and then from there you can create a meal plan based on your blood, or you can create a meal plan based on whatever health goals you have.
It also comes from cholesterol-based foods too.
Cholesterol, yeah,
Like high cholesterol-based foods, so
and
like fatty
oils.
foods.
Yeah,
So fatty foods, so
greases, like cooking with butters and all that type of stuff.
like
lard.
the margarine, the butters,
And then oils.
the oils,
If the
like
oils
the,
get too high heat.
yeah. What's that oil we used to cook with?
Canola
oil.
oil? That's the worst one.
Vegetable oil.
Yep.
Avocado oil is good for you.
Avocado oil and olive oil
and
are the
olive
two I
oil.
swear by.
Yeah, but you can't cook them at high heat though.
Not either.
Yep.
Yeah.
So you can't deep fry with avocado and olive oil. Y'all. It's not gonna work.
Yeah. Don't think you can fry some chicken.
Nah, you can't do that. But I mean, chicken is good. I ain't gonna hold you. Fried chicken is.
Yeah, because I feel like cholesterol does get a bad rep. There's good cholesterol and bad cholesterol.
It is. So real quick, put your own game. You have your HDL, and you have your LDL. You know which one's good, which one's bad.
Low density is the good one, right?
Yep. And then the HDL is a bad one. Yep. So again, just talking about just healthy oils, diet, like fruits, vegetables. Like I know for myself, like this past year, I've been focused on more whole foods. A lot of what we eat in the American Standard Diet is a lot of processed foods, and not just processed, but ultra processed foods. So your chips, your cereals, it goes through multiple processes to get it to its final product, right?
Any nutrients that may have been in it
are gone. So like whole foods is one ingredient. So if you look at the food label, right? Like we're getting into nutrition right now. Like
let's talk about
it. So look at the food label, right? How you have a lot of just different names and things you cannot pronounce. Those are chemicals. Those are man-made chemicals that who knows where they come from. But even in certain countries, some of those are banned, like the red dye 40 and what other ones are banned?
A lot of the dyes are. I think red dyes for sure. And
it's another one that's banned. I want to say it starts with a T. That's found in like meat. I can't remember what it's called. I just now found this out on YouTube. I ain't gonna hold you.
Don't eat meat, fam.
You don't. That's valid. But anyway, it's a chemical that they're putting in the meat to kind of make it that helps it to be preserved a little bit longer. You know what I'm saying?
What?
Yeah.
And that's a lot of what some of that stuff is. A lot of the things that are put into the foods are to help it have a longer shelf life. And you don't want food that goes bad. If it don't spoil on the shelf, what you think is doing to your digestive system?
Yep.
Think about this.
Yep. For sure. And like, so just getting back to what I was saying, like this past year, like I've been really focusing on whole food. So anything that has one ingredient, so apples, broccoli, salmon, chicken, like, you know what I'm saying? Like there's nothing extra in the food. Like I'm not eating chips no more. I don't even drink soda, but you know, soda has chemicals in it. I can't even tell you when I last ate cereal. Cereal is super ultra processed and it has a lot of sugar in there too. You know what I'm saying? So, anyway, I you know, I feel like nutrition is a thing that can just go on and on and on and on. But I guess because I really want them to get something out of that. You know what I'm saying? Like I really want them to take something home that they can implement today.
Yeah, start balancing your meals out a little more. Add some greens to your plate, some veggies. If you have a starch, you don't eat multiple starches.
I was gonna say that too, like carbs.
You don't eat rice.
Yeah, you don't
eat potato.
Yeah.
You don't eat pasta. You don't eat them all together. So you have your protein, you have your greens or your vegetable, and then you have, if you want like a sweet potato, those are really good for fiber. I love having a sweet potato with broccoli and salmon. That to me is a square meal. That's perfect.
Quick question.
Yeah.
So my mom, I love you, mama. She has been asking me because she's going through a little something. I hope I'm not putting your business out there. I'm not trying to,
It's
mama.
that time.
I love you.
It's
you know what I'm
that
saying? She going through a little health scare right now. You know what I'm saying?
Yeah.
And she's come to me and has asked for my professional opinion about she wants to go plant-based. And I told her that plant-based is not equal healthy. there are a lot of processed and ultra processed plant-based food, vegan foods, correct? And so I kind of want to just get into real quick, because I told her it's not about plant-based, it's about whole foods.
Yes,
you feel
I
me?
agree.
So we're gonna get into that in just a second. So with whole foods versus plant-based, what do you suggest for somebody who is trying to integrate or explore those options? You know what I'm saying?
Yeah, I would say, like you said, make sure that there are the least amount of ingredients in anything that you choose. You don't want to switch from one processed meat to another processed, even if it is claiming to be plant-based. So make sure that there are not processed if possible, and also shop the outside aisles of the grocery store. You don't need to do a lot of the inner aisles because your produce is going to be on the outside. That is primarily where you need to be. If you do want some beans or things like that, they can be bought either canned or dried because they can be great for protein. But also, I do believe in moderation. So I was vegan for about 2 years, or plant-based where I had no meat, and then I realized that I needed still some type of protein, and I chose to start eating salmon, mostly for the omega-3s, the fatty acids that are healthy for my brain. And I just was on a weight training journey, and I felt like it helped me pick up weight more and actually have it stick to me. So I honestly feel like moderation, going with things that are less processed, and also just learning about what works best for you and your body and what your goals are. But definitely do research if possible. But if you are looking to increase your vegetable intake, I would definitely say organic is best. If you can't afford organic, of course you can still do the standard, but make sure you're cleaning your vegetables well before you cook and or make any meals with them. And also seasoning. I think it's also something that should be talked about within the Black community. You don't need to. The Lawry's is good. I know we like Lawry's and Tony Zamarans, all that type of stuff like that. But you can season with herbs or season with more holistic type of plants and things.
And it does bring the flavor out too.
Like rosemary,
yeah,
amazing. Things like basil leaves or any type of thyme. Like thyme is really good. Mint. I like to season with those. So I have like a herb and spices that can help with your lowering of your sodium. So a lot of different ways and angles you can go for it. But just don't be hard on yourself. You're learning. This is a new process, and give yourself grace throughout it, because it was at one time I was really, really low weight because I didn't know what to eat for the protein. So do your research if you are changing to plant-based on how you're going to supplement that protein, because it's very important.
For sure. Okay. So switching gears, I have a question.
Yeah.
Do you feel like there are certain situations besides urgency or emergency based things or medical practices? Do you feel that there are some things that Western medicine is always going to trump holistic medicine, or do you feel like holistic medicine reigns king because when you factor in time, patience, and compliance, that kind of outweighs the instant gratification of what Western medicine and pharmaceuticals can offer?
It really depends. What came into my mind is, like, of course, like you say, the things that are traumatic, like surgery, things that incorporates more fusion of like bones and things that herbalism can help, but not necessarily get in there to do. So like surgery, of course, always going to trump. I feel that you guys have better testing abilities to be able to see levels that we can't do tests for. So I definitely feel like trumping the field of having the, I don't want to say scientific, but to be able to really look into the person. That's something that herbalism hasn't been able to really incorporate.
Or I guess what you're saying, like, look into the cells, like look into like the cellular level. You feel me?
Yeah. We don't have ways to test the cellular level of a person and to look at the blood work and things like that. So that's something that y'all do very well. And once you get your blood work, you just come over to us.
What about like the imaging, like X-rays, CT, stuff like that, ultrasound? You feel like that's cool? Why not?
Radiation. But it does what it's supposed to do. I don't know. I'm really on the fence about any of that. I don't even know if and when I have babies, I don't want to do ultrasounds and stuff like that. Not too much. I'm not sure about any of that as a practice. Just because I don't think I've educated myself enough to even like have a decision about it. But I know I feel a little uneasy about it because I feel like if you have to get behind a screen, lock a door or close it, and you're behind something and I'm actually in it to protect you, like, so what is it doing to me then? If that makes sense, as far as like a MRI and things like that.
True, but I can say that that's at like high levels. Okay. So like for me in my practice, right, if I'm in the ER, because we do regular imaging on patients all the time, so x-ray, ultrasound, MRI, CTs, all that. If you're just a regular patient that don't come in a lot, getting 1 or 2 a year ain't gonna hurt you feel me? Okay. But the actual clinicians behind it doing it, they have to wear the like wear the gear
because of the repeated use.
Correct. And they also have to wear, they have the little, I forgot what it's called, but it's like the little tracker, nano, it's something nano tracker or something, and they wear that when they're at work so they can measure how much radiation that they're being exposed to, because you can only be exposed to a certain amount per year.
Oh, I love that. Okay.
So that's also to keep them safe as well. So that's just to,
I didn't
ease.
know that. I didn't know that.
Yeah,
okay.
Yeah, so that's just to ease any anxiety around that. But I ain't gonna lie to you, like, there's been a couple times in the ER where, like, a patient is moving and we gotta keep them still for imaging, and like the radiologist or whoever's shooting their x-ray or whatever they're shooting, they're like, you sure you want to get in this? I'm like, girl, go ahead and shoot me, like, it's fine.
Oh, yeah.
You know what I'm saying? So there have been a couple of times where I feel like my ovaries got zapped, you feel me?
We don't know yet, but we'll figure it out. We'll see.
You know what I'm saying? But I mean, but that's like very, very rare. I can count maybe on one hand how many times I've done that. But in general practice, it is safe at very low levels. So I don't think that you have anything to worry about just being a regular human being. You feel me? Yeah. That's not being exposed constantly to the to the environment. But I think that those testing is very crucial, and sometimes those type of imaging and testing is definitive to get a correct diagnosis. Okay. So I think that's one way that we kind of do trump you a little bit is being able to see things that you guys can't see. Right. And I have another one. So how do you feel about antibiotics, yo? Like, okay.
So I'm against vaccines. I don't really like them. I don't know. I'm not totally against all of them, but like I'm against the COVID vaccine at least. Yeah. I'll say that because it was the most recent one. It was thrown out here. We don't know really what's going to happen in the next 10 years, but that's that on that.
But we're going to get into that. But I feel the same way, but I have some more reservations that just because time purposes, I don't, know.
So tell me in a way that I can understand antibiotics, because I know they're to heal if you're already sick. So it's like something to help you get better quicker. I know there's steroids, but what's antibiotics?
So antibiotics literally is what it is. It's antibiotic, biobacterial. Like it's so basically what you have is an overgrowth of bacteria in a certain area.
Gotcha. So like yeast infection, they'll prescribe you a antibiotic.
Yeast is different. Yeast is a fungi. Yeast is different. So that's a totally different thing. Right idea, wrong medication, but same thing. So for a antifungal yeast infection, so like you take it and it'll kind of kill off the excess of the fungi that's overgrown. So the way that it was actually taught to me in nursing school, actually, I will never forget this. We all have bacteria in us, right? In our gut, like on our skin. Yeah. On our skin is called staph. So staphylococcus. Yeah. If the staph get too happy and want to have a party and just be like, you know what, F it, like I'm gonna just grow, that's where you get staph. You feel what I'm saying? Right. Same thing with like to your point, like you have the candida. which is yeast.
Overgrowth, yeah.
Right. So it get too happy. You know, maybe it was exposed to something that it likes to eat on. You know, and that's different things that can happen. I'm not going to go into specifics, but it was introduced to something that's like, ooh, this is new. Oh, I like this. And now it's just multiplying, right? You know what I'm saying? So now it's just a whatever. But there are some instances where, like, the bacteria just decide, like, yo, like, I'm kind of bored. Let me just multiply. You feel me? So the antibiotics really is just what it is. It just kills off the excess bacteria, and it is going to kill off the good bacteria too. But the thing about it is, from what I was taught, is that when it kills it off, it'll kind of come back in its natural flora.
Okay.
You feel me? Yeah. So that's just what it is. I mean, and I guess my question for that is there any herbs that you know that can kill bacteria? Like, is that a thing?
There's antibacterial herbs. Yeah, there's a lot of herbs, especially that you can do topical, that can help with bacterial growth.
For real?
Yeah.
Like what?
It's like antimicrobial, like things like, I think nettles is something that can be used as an antibacterial, but yeah, I can't think of a lot off the top of my head.
For sure, it's so many.
As an antibacterial, yeah, I'm drawing blanks, to be honest.
It's cool. It's cool.
Because it's like, is it the same thing as being antimicrobial? Do you know that it's antimicrobial? It's like
yeah,
similar, but then I would say like golden seal.
Because it's the same thing like when we take blood culture. So like if a patient is showing signs of infection, more times than not, it's a bacterial infection. You feel me? So with viral illnesses, you have to just treat the symptoms. You do have antiviral medications. Yeah. But for the most part, like, you have to just treat the symptoms and let that stuff ride. You know what I'm saying? With antibiotics, though, you have different spectrums. So you have what's called like broad spectrum. So your zosins, your vancomycins, your roceptins, those treat pretty much anything. Those are your heavy hitters. So if a patient is showing signs of bacterial infection or some type of infection, we'll give like broad spectrum. But before we even do the broad spectrum, we'll draw what's called blood culture. So we'll draw your blood into these special big old tubes. There's 4 of them, and the micro lab will grow them in a petri dish for like 48 hours. I think it's 48 to 72. And depending on what grows, then they are able to see what type of bacteria grows on the petri dish to be able to change your course of treatment. So in the time being, we're treating you for pretty much everything, but there's going to be a couple of little bacteria that's still going to be lingering because it's like, okay, you can't kill me, ha ha ha. Right. No, I got you. Because now it's this or now it's that. So now we can switch the course.
No, I do like that.
To the actual specific type of it's like gram negative, gram positive. It's specific ones, but yeah.
Interesting. So she just gave me a little mini course on antibiotics, y'all. I'm not gonna lie, there's a lot I still don't know.
And the reason why I know this is because I failed microbiology and I had to take it over. You feel me?
I'm gonna know this time.
I know this time. Yeah, I did. But you know, I'm still a good nurse though. You feel me?
Period.
But yeah, so for sure. So I guess now we can kind of switch gears to how can we both collaborate together? How can we make our worlds collide?
I definitely feel like you don't have to do one or the other. I believe that they can integrate well, and you can still do whatever medicines or whatever type of care that you do have or need, but also incorporate some self-care, incorporate some type of tea, incorporate some type of herbal medicine that can at least start a journey of being less dependent, which I think is the overall message for me to my people. I don't want you to be too dependent on medicines. Even with herbs, I don't want you to have to live or need something to feel like you have to live. So
for sure.
Yeah.
And I mean, even as a Western practitioner, I don't want my people or anybody to be on medications for a long term. You know what I'm saying? Because it's still chemicals that we're putting into our body, man-made chemicals that's not from the earth. I guess my question with that is, with this being a new topic, even for me, accessibility, like how can somebody get how can somebody, for one, find a herbal practitioner? Funding, how they pay for it, does insurance pay for it? Like, give us a tea, sis. What's going on with it?
So that's where it does differentiate from the Western medicine field, because we're not like a licensed field or necessarily. You can be a naturopathic doctor, or you can be an herbalist, or you can work in holistic medicine. Naturopathic doctors, they do have of course, the studies. They've gone to school and they have the doctorate, but they still can't bill insurance. And that is one of the ways, or one of the things that I think makes us less accessible, because you have to pay out of pocket for any of our care. A lot of people may not have the funds to come and see us, and they depend or rely on the insurance model. So I would say...
And girl, even insurance for regular medicine is expensive.
Yeah.
And, you know, you got co-pays and out-of-pocket fees for stuff like, man, listen, I don't even want to get into that right now.
Yeah, but we are out here. There are people that are willing to work with you. If you are open to more holistic healthcare, I would say look up naturopathic doctors' offices or clinics in where you are located. I'm on the West Coast, so it is a lot more available. I don't know how it is here in the South as of late, but if you look up naturopathic doctor's office, I'm pretty sure there's people that you can find, or holistic people, holistic medicine. That's a good term to look up for people that are mostly just open to more of a natural treatment. So even homeopathy, that's another way of dealing with medicine that is not just pharmaceutical. And just do your research, find your practitioners. There are databases that you can search, but also if you want to connect with me, I have an Instagram page, Lune Herbals, LUNEHERBALS, and you can find Instagram, Facebook, and be able to connect with me that way. But I would definitely say just look for databases where you can find these type of practitioners. And that's one of the goals I ultimately have, to be able to create a database where people can find alternative health. So, yeah.
I like that.
That's the overall goal.
That is the goal, right? Okay, so, and I have a comment. When you were talking about, like, how the insurance doesn't pay for it and things like that, I honestly feel like that's an investment, though, because you know how we talk about with your practice of medicine, it's not an instant cure. It takes time, it takes patience, it takes compliance. And in this world where we want instant gratification, we want things to happen right now, tomorrow. I think that it's difficult for people to kind of buy into that, or to see the vision of this is an investment. And that kind of just goes into how I feel about just the world today. I feel like we are very capitalistic driven, you know, we're money hungry, you know, we don't really care about the quality. We kind of just want the quantity, you know, we want to scale fast and, you know, make more money and things I'm not going to get into politically, but, taking that same ideology and breaking it down into just being an individual, I think people can't see the vision of, like, okay, if I buy into this for a couple $100, you know, am I really going to see results? Am I really going to feel better? Am I really going to, you know, you feel me?
But people will pay thousands for a quick pill. You know what I'm saying? People will pay thousands. And a surgery.
No shade, no tea.
But you won't put in the time over 6 months, over 12 months to work with somebody that is more holistic. And I think that they have it a way to make it less accessible. So it's like, you can build this on your insurance. You can get this treatment quick. Yes, we can be here for you right here, right now. But how much time do you really spend with your doctor?
Like 2 minutes, bro.
Okay.
Maybe 5 max.
That's what I'm saying. It is an investment for sure.
But that's also because there is more pressure on the healthcare system right now to see more patients, to get more money. So it's like a
machine that's running on its own.
Yeah, for sure, for sure. I guess so. For me, because I've done my work and I've been to therapy, and even on my personal fitness journey, you know what I'm saying, I've had to sit with, like, okay, working out, doing the same workouts for 2-3 months, and I'm like, oh, now I see some abs. Now I see, you know, my back getting big, like, no, for real, like, it really does take consistency.
Yeah.
And it takes like you showing up every day. And showing up every day does not mean giving 100%. Showing up could be, okay, today's Monday, I have 10%. Today's Tuesday, now I got 15%.
Right.
Today's Wednesday, I have 95%.
Right.
Today's Thursday, shoot, I got 65%. You know what I'm saying? And like, but you're still showing up.
Every single
Slow motion is still motion.
Hello. I love that.
You know what I'm saying? What's that law? A object that stays in motion, that's in motion stays in motion.
Yeah.
That's Newton's
Newton's
law.
law.
Newton's law.
Very true.
But once you stop, you have to exert a lot more force
To get the ball back rolling.
Thank you. Come on, somebody.
She finna preach, y'all. Look how she looking. She about to preach.
Because like I've read the 48 laws of power, so it just goes back into universal principles of law.
Yeah. You have to give to receive. You have to sacrifice to gain.
And there's balance in everything that we do, even nature.
Yeah. Yeah.
The sun's still gonna rise in the morning, and the moon gonna shine
At night.
Thank you. Come on, somebody. Hey. Hey, come on now.
But for real, you
Come
have
on now.
to do
You
the
have
work.
to. You have to do the work.
You have to do the work.
And this is a part of the podcast that I'm really wanting to kind of go into.
It puts it more on you when it comes to natural medicine, I feel. I ain't
Yeah.
gonna cut you off, but
No,
it
you
puts
good.
it more like how you say, I have to get up, I know I have to work out, I have to do the meals, because it puts it more on you instead of this medicine or this doctor telling you what to do. It gives you more autonomy.
I have an example, but go ahead.
Go ahead.
No, go ahead. Go ahead.
It just gives you more autonomy, but you ultimately have to be the one that is doing the movement, like keeping the ball rolling.
Keeping the ball rolling and just showing up every single day. Again, you don't have to give 100%. I think that we get it misconstrued that we have to show up 100% every day.
And
That's
we don't
not
show up at
realistic,
all.
man. There are natural erbs and flows of life. It's going to be ups, it's going to be downs. Every day you're going to have a different priority that needs to get done. But if your goal is to work out 5 days a week, whatever, and all you have is just 10 minutes of some type of movement, put on a YouTube video.
Yeah.
There's free, you know what I'm saying? If you get some type of movement, you're still having motion. But what I was going to say was, with like showing up for yourself and not putting your trust in a pill or a doctor or somebody. The other day I had a patient that I was doing an assessment on at my job, and I was getting to his medication reconciliation, which is just me verifying what medication he takes. This man could not tell me nothing but that he takes 5 medicines. He couldn't tell me what it was for. He couldn't tell me the name of it. He couldn't tell me a dose. He couldn't tell me nothing. And I said, you don't know what you're taking it for? No, I don't. I just take 5 medicines. And I said, that's so dangerous. And my preaching voice came out, and my coworkers always laugh at my preaching voice because it's funny, but I'm serious.
Right.
Because I care about people.
Right.
You feel me? That's why I came into this space, and I feel like that's ultimately why I was placed on this earth.
Yeah.
Is to mentor and to educate people
I love it.
on things that can help them to elevate.
Yeah.
But anyway, that's a whole different thing. But so yeah, I mean, I really just sat there and I've kind of drilled him and kind of asked questions to provoke thought of, okay, well, why did you go to a doctor? Okay, well, I do remember, my chest was hurting, and then, they had found this, and, and he don't know like the actual terms, but I'm able to walk him through going back through those scenarios. Okay, now, so we're on a blood pressure medicine. We don't know what it's called, but at least I have something to go off of. You feel me? But even just then, I told him, I said, that's very dangerous to put your trust in another human being. On top of that, you are the only person that is responsible for you.
That's it.
That's it.
Just imagine you out somewhere, you on medications, you might eat something, smell something, have something else just by chance, and it's it interacts with your medicine.
Exactly.
That's a sad story.
But that is, when I tell
that's
you,
the reality
it's
of a
more
lot of
common than we
people.
think. It's more common than we
And that's,
think.
to me, it gives your sovereignty over. You have to take the power of your healing back into your hands. It's yours. It's your health.
It is. So, I was just, so I think me just pouring into him really, he was a little irritated by me. I ain't gonna lie.
But I hope he woke up a little bit.
But I
Some
think
people
that
need cold water.
And I think that he did. I think he was like, you know what? Okay, cool. You know. So I told him, I said, you know, I challenge you that next time you go to these appointments, that you ask what these medicines are for, you write them down, and you figure out why I'm taking them and how I can better take care of myself to be able to get off these medicines. So that way I only have to remember 5 medicines. You feel me? Mm-hmm. But you know, that's just a whole nother thing. But let's go ahead and wrap this up because we kind of been talking for a minute, right?
Just a little minute. A little minute.
I feel like I'm definitely going to invite Cam back on the podcast. Yeah. I feel like there's a lot more topics we can talk about.
That's all right. You can come out to the West Coast. We can do it.
Shoot.
Oh, we can have you do some actual practices. Come through to the doctor's office. Get you some acupuncture, some Reiki.
I'm cool with that. Like a day in the life type of thing?
A day in the life.
I like it. All right, so I got a couple of things to wrap us up with. Cam, can you just share with us some everyday practices that anybody who is interested in holistic health or is I guess like what that looks like for them if they're interested in doing it?
So like daily movement is important to me. Like you talk about lifestyle, working out, any type of stretching, yoga, even if it's dancing. We have a lot of stored trauma in our bodies, and with you moving, stretching, you're getting it out. So I think that's very important to incorporate. I would say, like I talked about earlier, quiet time to yourself. Very important.
Okay, I'm sorry.
Go ahead.
Real quick. It is okay to be bored. It is healthy for your brain to be bored.
Right. You don't have to have these constant dopamine shots from social media.
Yes.
Put the phone down. Stop doom scrolling when you get home.
Constant stimulation is frying your brain.
Yeah.
But go ahead.
Take that quiet time to yourself.
I'm telling you, it works.
Put that D&D on. Take time for yourself. And then I will also say, I like tea. I'll say I do tea every day, just about. It's something that helps ground me and centers me, and also it's medicinal. Also, something I think is important, we need to talk about sea moss. I love sea moss.
I got sea moss in the fridge.
Yes. Yeah. So, incorporate
a lot of minerals.
Multivitamin.
Yeah.
Multivitamin daily gonna help you a lot.
Yes,
it has 102, sometimes 92 vitamins and minerals that are essential to your body's health.
I swear by sea moss, y'all.
It's so good
my
for
inflammation in my gut went away.
It's good for digestion. It's good for weight loss. It's good for testosterone, hormonal balancing. Sea moss is very, very good.
And sleep too. I've been sleeping
So I take sea moss daily. I don't know where you are, but I know Sprouts, different locations may have a more commercialized version. But if you go to like farmers markets, mostly you'll find a vendor out there that'll have sea moss for you.
For sure.
So sea moss, tea, daily movement and stretching, and quiet time. One that I love, just for me, I like to write. I'm a poet.
Hey.
So I love to write, do spoken word, and just get my feelings out that way. So if you like to connect with any type of creative outlet, that's also an amazing way to take care of yourself.
For sure. Okay. Well, I'm going to just share a couple things that I like to do. Journaling. I used to be a writer for journaling, but I found that I'm more of a talker, hence why we have the podcast. So I started to keep a visual journal in my phone. I'll just prop my camera up and just get it talking and just talk it out. Because when I talk things out, I get more clarity versus writing. Writing kind of bores me, so I mean, it's what it is, but that's just me. Yoga has definitely helped a lot. It's helped to center me and balance me. And going for walks in nature. Like when I am frustrated or when I am feeling stuck creatively, I just kind of just go for a walk. Or if I'm dealing with something that I don't know really the solution to, I go for a walk, and it kind of helps to just that movement get everything flowing, and I kind of end up coming out with with an answer. Yeah.
One last thing I'm gonna add. I think I already talked about it, writing, but creating. I think creating something daily or creating something is a really good way to get stuff out.
For sure.
Any type of creation, photography, writing, painting, drawing. We're creative beings at our core. We have things that we have to get out, passions, things that we care about, that we love. Incorporating something that you hold as yours.
Like you remember I told you like a long time ago, or maybe I'll do like an Instagram post. You need something that keeps you creative. Remember that?
Something that pays you.
Something that pays you. Something that keeps you moving.
I remember that.
Yep. And it was like 4 of them.
It was about 3 or 4. And I was like, I commented on it, and I said that's very powerful because it's exactly, you find a hobby,
that keeps you creative, a hobby that makes you money, a hobby that keeps you healthy or moving, and a hobby to do something else. I forgot, it was like 4 of them. I can't remember.
That was a great
staple. Off the dome too, man.
No, but we're multifaceted beings. I feel like we box ourselves in our jobs, our roles for people that are in our lives. I'm a mom, I'm a doctor, I'm this first, but you are a human being.
Correct.
Be. Find space to just be sometimes.
But before I have you say some final words for the listeners, I do want to say this. If you can put your trust in a pill, if you can put your trust in surgery, if you can put your trust in these, I don't want to say extreme measures, just trust the process of taking a supplement or taking herbs or, being patient with yourself to learn how to sit and meditate in that process of like your mind wandering and how to redirect it back to quiet. It's like it's a process and it's a new muscle that you have to work over and over and over again. But eventually you will get stronger in that area and you will see the results that you are yielding.
I agree.
So I think same thing with like therapy, like don't get frustrated if like you and your therapist don't connect the first time. Like you have to keep working at it, keep trying, or keep finding what works for you. Same thing with the holistic side of medicine. Like, one herb may not work for you, but another one may. You know what I'm saying? We're all built different. We're all genetically made up differently. And I just feel that it's important to just give yourself space and time to explore that if longevity is what you're seeking.
I agree.
But with that, I want to, have you just say whatever you feel the listeners need to hear to leave us off with something that's impactful.
I think that you are powerful.
Ooh.
Even you just watching this video starts a conversation in your mind to you looking into alternative ways to heal yourself. I want you to take your power of your healing back into your hands and just trust your body. If anything else, if you take nothing else, if you don't go do any herbs, if you don't go to the doctor, trust in your body's ability to heal you. And watch how things will start to change and different healing practices will start to come to you. Put the energy out that you're looking for a specific type of healing and allow that education, the people, the community that you need around you to facilitate that healing.
For sure.
Once you put your feelers out, once you put that vibration out that you're seeking healing, the things will come to you. So you don't have to make a move. I just want you to be educated and to understand that there's different ways and different things that you can, like Serena or Anera said, different ways that you can experience healing. So
for sure. It's almost like what you just said, like fishing. Like you put the bait out there, you wait. And the fish will attract to that, to that bait. But I enjoyed this episode for sure.
I enjoyed it too. I hope you enjoyed your tea.
I did. Hey, it was bomb. I ain't gonna hold y'all. I do feel calm. We've been on here for an hour and a half almost, and we just been kind of vibing, chilling. It tastes very sweet. Not sweet, but it's not bitter. If y'all was wondering,
it's not very earthy. You got chamomile, lemon balm.
It's very like balanced. That's all I can really say. But where can people find you?
So you can find me on my socials on Instagram and Facebook at Lune Herbals, LUNEHERBALS. There you can find my website, but it is luneherbals.square.site right now. And you can just connect with me there. For my email is luneherbals@gmail.com. If you do have any questions, you can always email me.
And I will also link everything she just said in the bio as well, just in case you didn't catch that.
Just in case.
Just in case. But it's always good yapping with a friend.
Yeah.
Again, I want to extend my gratitude for you coming out here.
Thank you.
For being a good friend to me, as I hope as I've been to you.
Of course.
Continuing to support each other in more ways than one, as we always done. And for the listeners, I hope that you at least took one thing from this that you can apply today. And as I always say, tell a friend to tell a friend to tell a friend. Join the conversation, join the community. And with that being said, I thank you for being here. Thank you for giving me your ear, listening to us yap, respectfully in our differences of careers. But I think the beauty of that is how we're different, but we still kind of come together at the end. So
yeah. I want to give Anaris her flowers. She has grown so exponentially, and I am proud of this in her new endeavor and the lives that she's going to touch with this podcast. So, like she said, tell a friend and tell a friend.
To tell a friend, man.
Period.
Because that's how we get the conversation started. And that's what it is. It's just a conversation. So I thank you, friend.
I thank you.
For sure. Until next time, guys, of course, like, comment, share, subscribe. All that you already know. This is episode 6, so you know what the deal is. I don't gotta keep saying it. Also, too, if there's something in this video that you resonated with, drop it down below in the comments. If you have a question for Cam, drop it down in the comments.
Let me know.
And let's get the conversation started. I feel that, again, this is powerful. And I'm looking forward to having you on here again. I think that we can kind of cook up something for them.
For sure.
For sure. So until next time.
Until next time, y'all.
All right, y'all. Be safe as always. Peace.